topic is about how to be with people who have depression. Okay, here's a quick list for our speech. First, we will see some statistics of depression as an introduction, and then we will see some things before we taking care of them. And you will get to know some background knowledge of depression too. And then the last part of this speech, we will see things things we have to notice when we're interacting with them. According to World Health Organization, over than 350 million of people suffer from depression every year globally, and women are 70% likely than men to get the diagnosis of depression. I think it is maybe women are more sensitive to the mood change, so that's why. And there are 1 million deaths of suicide every year because of depression. So you can see it is a very serious issue of mental health field. And then before we really know how to help them, we really have to know how to save yourself first. A lot of people may feel guilty if they put themselves first, because they think it is a hard idea and it's unfamiliar for them. But the truth is, if you don't do that, you will burn out. Even before you can take care of them. So how to save yourself is you have to balance your life with work and relax. Many of you may be curious about how people can balance their life from work. I think, in my opinion, a work with self-accomplishment can give you a life of purpose. So that's why you really have to keep working. And then you also have to relax. I highly recommend you to develop some hobbies in your spare time to energize you or refresh yourself. And then you will know it is really hard to take care of them only by yourself. That means you cannot do it all alone by yourself. It means you need to get some social help. You need to build up your own social support net. And don't isolate yourself. Please tell others to help you. Tell others what do you need them to help you. That means you need to be open up a little bit to other people, because maybe it will be scary when you be open up a little bit to people, but you will also get some you will also get some gains out of it. And you need to seek for professional advice. I know you are probably not the one who suffers from depression, but you really have to have a place to let go of your negative emotions. For example, some people may think when they're interacting with people who suffer from depression, they will think, can you just try to look on the bright side, don't focus too much on the negative stuff. Once this kind of thoughts occur in their mind, they will start to feel angry. And they will avoid spending time with them to take care of them. So it may distance. This kind of emotions and thoughts will distance us from people who suffer from depression. Especially the one who suffer from depression is the one we love, like our friends or our families. In the contrary to angry, some people may feel self-blaming. They may feel, they may think maybe they're the one who is to blame for their situation. For example, if a daughter, she might think maybe I didn't behave well, so that's why my mom get depressed. so I have the full responsibility for her illness. So I have to do more for that. So this will hinder them from setting a boundary between those people who is in need, because you're not Superman. You don't have to really be on call 24 hours a day. You need to relax yourself. And here are some signs you can observe for depression. Depression is not only about negative thoughts or negative moods. It is also about sleep, appetite, and weight change. For example, if I usually sleep 8 hours a day, and I really need to sleep that much. If I really need to sleep 8 hours a day, and I take 3 meals a day, but if one day I start to eat 12 meals a day and sleep over 20 hours, then you may know something wrong with me. Yes, and this can also lead to the weight change. I may gain some weight or lose some weight too. And one of the significant feature for depression is called lack of enthusiasm. People who suffer from depression has no motivation to do things they used to like or they really like to do. They really want to do. Maybe we can take Paul for example. If he stopped running marathon in a cup, maybe you can see he might suffer from depression and you can care about him.
I don't want to.
Nothing wrong.
Yeah, that's the main reason. A new girlfriend.
Falling down.
Okay. Then some gossip here. Okay, and then here are 3 typical negative thoughts for depression people. They will overemphasize their thoughts. For example, if I dropped a cup, then I would think, oh, I'm too clumsy and I cannot even handle this cup. What am I doing? So this is overemphasize of thoughts. It's just a drop, okay? And the second kind of thought is called catastrophe. Catastrophe is also the end of growth thinking patterns. That means, for example, if I didn't catch on the bus today, and I may think, oh my God, what the hell, I didn't catch on the bus, and it's the end of work. This day will totally be ruined by this catastrophe thinking patterns. And the third one is called personalized. That means if I came here late and I dropped my cup at my home and I didn't catch on the bus, and I saw Iris and Iris didn't say hello to me, then I'll think, oh, maybe she hates me. And I'm worse, so I will start to blame myself. And that's no wonder they always blaming themselves and look sorrowful or sad and with low self-esteem and feeling worthless. And they will think maybe even if I die, that no one will discover it. So on the contrary to self-blaming, they will also blame others. This will happen when they don't really accept. This will happen when they don't really accept their illness. They don't think they are the one who can be the first change. They will blame others. Like if I'm a mom, then I will blame my daughter. It's all because of you. You didn't do well at school, so that's why I suffer from depression now. So this kind of thinking patterns or emotion will push people away. So that's why they are really hard to be with. And the other significant feature for depression is called suicidal ideation. And the people who suffer from depression, they cannot really stop from thinking killing themselves by any means. They will think about it most of the time. And this kind of ideation will lead to a suicidal plan. They will start to think when, where, and how they can kill themselves. And this plan will evolving to an action. Like they will give their valuable things away to their friends or their families, or they will start to write a will, and they will buy some tools or look for some stocks for killing themselves too. And I think this will be an interesting one. Which one do you think is more dangerous? The one who is hospitalized in the hospital, or the one who was just released from the hospital? Which one do you think is more dangerous?
It depends on the season. If it's in winter, I think hospitalized people are more dangerous.
Okay, so maybe everyone have your answer in your mind, right? The answer is the one who just released from the hospital. And why? For two reasons. Because in the hospital, maybe doctors and nurses will keep an eye closely on them, so they will, they will have less chance to kill themselves. That's reason one. And the second reason is they'll feel. Remember, we just talked about people who suffer from depression. They will lose their motivation to do things they used to like or they really want to do. So in this case, people who suffer from depression, they lose their motivation to really killing themselves. They still cannot stop thinking about the suicidal ideas, but they just don't have the motivation to do it. So they tend to be very helpless, as if they cannot do anything for them to be better. And they also show helpless a lot of time because they don't think there are anyone who can pull them out from this kind of situation. So it's really hard for us to be with them. What can you do? I will give you these suggestions. Just be patient because you cannot expect that they will stop talking about their negative feelings or negative thoughts. They will just keep repeating again and again. And you should listen instead of giving them advice. If you try to give them advice for once or twice, then you may feel frustrated by yourself because they will reject almost everything from you. They will say things like, "Oh, you gave me a really good suggestion, but I just cannot do it, blah, blah, blah." So maybe you will be irritated by them of this kind of behavior patterns. And avoid, I think the third one is very important. Avoid saying cheer up, because the underlying meaning of cheer up means you think they are not trying good enough. You think they should put more effort to help themselves out of this situation. So this will put much more pressure on them, and they don't feel better by your words. And the fourth suggestion is to develop an activity you can do together. And I would suggest you to develop an exercise you can do together. Sometimes this can force them to really interact with you. Yeah, sometimes playing table tennis or some ball games. But actually, in my opinion, I think take a walk and chat with them is good enough in this kind of situation. And encourage them to seek medical or professional help. They may need some professional or medical help from others, from the doctors or from counselors. But it's a really hard part. It's a really hard part because they can always refuse your suggestion, and if they don't think they are ill, or Maybe they think it's troublesome, but they don't want to change it, you know. So once they tend to be like this, you can always go back here. Here. Yeah, you can seek for the professional help first by yourself.
So anything I cannot give them advice. I cannot say cheer up.
You can try.
So anything I can say to them.
So don't say cheer up. Cheer up.
Go to the help.
I know sometimes it's just we just want to be kind to them, right? But sometimes 加油 or cheer up will make them feel worse.
It will remind them some bright side, brilliant side of the world.
You can try.
Like chatting with me, something like that.
Yeah, you can try to do that. You can try to do that. But even if they didn't or they don't accept this, don't be discouraged or don't be frustrated by their reaction, because they tend to behave that way. So just keep caring about them. That's good enough.
But I think ask them to seek for the professional help is a very hard part, and that's also an advice. But you said that avoid giving them advice, and that would make them feel very angry. If you ask me, hey, you should see a doctor, man. You are not, then I will feel very angry. You know, this kind of suggestion will make them, if they are really a patient or they really suffer from depression, I think it takes a lot of skills or a lot of effort to do the last part, and that's very, very hard. That would be very, very hard.
Let's try. You should go to see a therapist.
No, that's not a good way. Let me show how to make it done. I want to see a doctor. Would you like to go with me? Better.
Oh, better.
Because I got pregnant. Oh no, just kidding.
Yes, I think it's the most difficult part. And so that's why I encourage you to develop an activity you can do together and build up the relationship bonds. So they won't feel, maybe you will reduce their defense when you raise this topic. Maybe they really suffer from their illness, but they just don't know how to talk about it with other people. So just keep caring about it.
How do you define that the patient is recovery or not?
From their, I think these items you can check is the most basic items you can check. For example, when she is ill, she usually sleep 3 hours a day, but maybe when she recovers, she'll sleep more, back to average. Any questions? Okay.
Oh, can you is it good to suggest them calling the hotline? Like, or should you tell them to call the hotline or not?
Yes. I think maybe you can give them some numbers they can call. It's better than nothing. But make sure the hotline works 20 hours.
Don't give my phone number
I think here's are some simple common sense for medicine here, and I think we can be a really good consultant if you have questions about medicine. And what is the medicine for? It's just like a flu. If I have a runny nose, and I think medical disorder is just like a flu. If I have runny nose or sore throat, then maybe if I take a medicine that can take this kind of symptoms away, and it will avoid the brain damage. That means our mood has its own cycle. So if we suffer from depression for 3 to 6 months, and then our mood status will go back again to the average level. But once it dropped again or become worse, then our brain may cause some damage to our brain too. It will affect our memories. And if you're going to take a medicine, please give 1 to 2 weeks for observation to see whether the medicine is suits you or not, or maybe you need to change the medicine or stop the medicine. If you have any side effects, please talk about it with your doctor, psychiatrist doctor. They will change the medicine for you, but at least you have to give yourself 1 to 2 weeks for observation. And if your loved ones who suffer from depression, they don't want to take any medicines, then they need to have a strong will to recover. That means they need to do more to combat their symptoms in order to become normal again. You know what I mean? Yeah. And you will need to help them to strengthen their social support. Because in Willie's case, he just shared with us those people who were hospitalized in psychiatry, in 精神科, they always isolated themselves and no social support network for them.
Which means that's not good to stay in the hospital.
What?
Does that mean it's not good to stay in the hospital?
So just encourage them and don't give up. This is all I have.